Good morning, everyone. I want to thank Dr. Sani and the Indian Association of Gastrointestinal Endosurgeons for this opportunity to present on a topic of starting and excelling a robotic program. I am Dr. Gamagami. I'm a general surgeon with 30 years of experience in general surgery from foregut to the hindgut, and I've been performing robotic surgery for approximately 12 years. I am located in the southwest suburbs of Chicago, in New Lenox. You're always more than welcome to come and visit. My hospital is a 350-bed hospital, and it is a community hospital with essentially all specialties. I've performed well over 4,800 cases. As you can see, I perform a variety of cases from colorectal resections to gallbladders to abdominal wall reconstructions, esophageal and pancreatic resections. The key to success essentially involves engagement from the administration. That is the most important element for a successful program, is that you have to have a buy-in from your hospital administration with regard to your vision. So once they are aligned with physicians, the focus will be on safety and quality, and more importantly on the patient's experience. And certainly partnership with Intuitive has been of tremendous value from many aspects of education, training, promotion, and also being the leader in being the first in presenting the many of the new aspects of the technology. We started our robotic program in 2012. This hospital is a replacement hospital. The older hospital was somewhat in need of major repair, and this hospital was built 12 years ago, and we acquired our first robot in 2012. We began with one robot, and as our volume grew and expanded, we essentially grew to approximately now 6 robots and 1 Ion. And in fact, I've been notified that next week we'll be acquiring our 7th robot for a DV5, trying to continue with advancement in technology as it continues to grow. As you can see, we've had a steady increase in the volume of our robotic cases over the years, and we anticipate by the end of 2024 we should have completed well over 2,000 cases. We have had approximately a 5% growth per year since we started our program in 2012. We have performed well over 17,000 cases since we began our program. We are the busiest center in the Midwest and have performed more robotic surgery, and we are ranked 3rd in the nation. If we look at the distribution of the cases, when we began, general surgery was a small percentage relative to gynecology and other services combined. But in 2014, there's been an increase in the volume of the general surgical procedures and colorectal procedures over the years, where they account for close to 60% of the volume. Our robotic program is a comprehensive program that entails not only just general surgery, but gynecology, colorectal, foregut, urology, and thoracic surgery. If we look at the growth of the general surgery, there's been a steady growth, but what is more interesting, not only has there been a general steady growth in our robotic surgical cases, but all our general surgery cases have grown essentially over the years. So a robotic program can be very beneficial to the growth of a general surgery program in an institution. What was very instrumental in the growth of our program was establishment of the MID Institute for Robotic Surgery in 2015. The institute was a creation where encompassed many elements, including a group of surgeons, administrators, and OR staff to provide a mechanism where we can differentiate exemplary providers in this institute to provide quality care. We created a robotic committee, and we have all the elements in place on an annual and a monthly basis to assess so we can continue to improve on our quality and our efficiency. The Midwest Institute of Robotic Surgery involved a group of surgeons collectively deciding as to what are the criteria that would be beneficial to allow membership into this collective group so that the hospital can provide quality care with the highest level of patient satisfaction and outcomes. And we decided that the surgeons should be relatively what can be considered high volume surgeons. They would have the lowest surgical site infection rate and the lowest readmission rate, and hopefully with minimal conversions. And we set out certain criteria for colorectal, ENT, general, gynecologic, thoracic, and urologic surgery. And each criteria was given a certain score. And collectively, if these scores were being met, then the surgeons could be elected to this Midwest Institute of Robotic Surgery. And what is important, we review these data on an annual basis. So just because you have a membership to this society this year does not guarantee that you'll remain within the Robotic Institute Surgery Committee for life. So it requires that the surgeon maintains competency and quality on an annual basis, and essentially those criteria determine whether or not you are included in this Midwest Institute of Robotic for Surgery. And in fact, if you look, when we started, only 42% actually met the volume criteria, but after assessing all the quality measures, only 17 qualified out of the 45 surgeons at the time. We have since then grown tremendously, and we have close to almost 90 robotic surgeons on our staff. When we look at the operations being performed, something as simple as cholecystectomy, well over 85% are being performed robotically, and the penetration of robotics in all the domains of surgery can be seen, including inguinals, ventrals, bowel resections, and fundoplications. When we analyze our data, this was our most recent data. Our conversion to opens were 0.6%, our readmission rate less than 2%. And you might consider readmission as a criteria that may not be as important in certain cultures or countries. But in United States, hospitals are rewarded if they can demonstrate lower readmission rates, if they have diminished surgical site infection rates, and if they have good patient satisfaction scores. And for that reason, this is one of the criteria that we tend to follow, and our actually readmission rate was less than 2%, and our surgical site infections of 0.3%. One of the things that is really made the Midwest Institute for Robotic Surgery very successful is the fact that the hospital is very active in marketing individual surgeons for their various specialties. In fact, this is not about promoting an institute, but it is about promoting physicians with good quality work and as to what it is that they do. They do it through paid advertising, they do it through patient stories, they have very strong web presence, and certainly patient lectures through education. For example, they have various podcasts, and it's open to anyone who is within the Midwest Institute of Robotic Surgery to actually give lectures and talks on specific topics that they find of interest to the public. And there are always venues for patients to search and further educate themselves further with regard to the services that are being provided by this institute. Another element that was crucial in the growth of our program was actually expanded access. Expanded access had to do with the fact that we had obviously 6 robots, and initially they were going from 7:30 to 3 p.m., but eventually expanding that to 7:30 a.m. to 7 p.m. and subsequently going to 24-hour service, and furthermore expanding the access to our Saturday and Sundays. And what is interesting is that well over 20% of our robotic cases that we perform at our institution are performed after 3 p.m. or on the weekends. It's crucial, as there is growth, there has to be operational efficiency and there has to be standardization of equipment. For that, we have our Nikki, who is our lead nurse coordinator. She's responsible from the day-to-day operations to training and education. Needless to say, one of our requirements for any new staff starting at Silver Cross Hospital that they all have to be trained in robotic surgery. It doesn't matter if you have a cardiac program, orthopedic program, or a neurosurgical program. We have all of our staff, irrespective of their subspecialty, to be trained in robotic surgery, because it is important that the access is available 24/7. Not only are we training all of our nurses and our technicians to be facile and versed in robotic surgery, but it is the job of the robotic coordinator to make sure that they maintain the inventory, make sure that the trays are standardized, and make sure that every surgeon's specific requirements are outlined in a manner that provides for efficiency. Clearly, we try to be nimble, and we always seek to establish, to improve our efficiency, and there is Genesis through Intuitive that can provide information, and partnership with Intuitive will give you the opportunity to assess your program, and this service is actually provided at no cost to you, whereby Genesis sends their crew, assesses your OR, the turnover time, and determines areas that you can continue to improve, and that has been very instrumental. And despite our volume and efficiency, we continue to utilize the Genesis program every few years to continue to improvement our process. The key to a successful program, obviously, you want to improve your efficiency through not only your OR personnel staff, but also anesthesia. Also, we continue with our education through various disciplines, improving our surgeons in terms of their efficiency by creating standardization of equipment, and also measures to improve and decrease our operative time and turnover times. Clearly creating block time. Every surgeon is given a block time, so that way we can make sure that the surgeon has access. And not only do we assess block time, but we assess the utilization, making sure that our surgeons are utilizing their time. And if they're not, they actually will be reviewed. And at such points, they may actually lose some of their times if they're not being 100% utilized. Making sure that the operating room is available after hours and on elective cases can be performed on weekends. We have specific dedicated rooms for the robot so that we can maximize the volume of the robotic cases that we can perform. And we have added additional robots to perform emergency surgeries at the times when all the robots may be blocked by blocked surgeons, to increase the volume of our robotic cases in our institution. And we continue to collect data from every aspect, from OR time, turnover time, surgeons OR operative time, and cost per case, and cost per case per various procedures to optimize the outcomes with regard to efficiency and our productivity. Our robotic program is really successful because we have engagement from all aspects that are necessary to make it successful. certain surgeon champions are necessary in various specialties. In fact, collectively, between the general surgeons, the bariatric surgeons, the gynecologists, the urologists, we need surgeon champions in all the various specialties to be fully engaged and be truly believe that this technology is of value. And through the hospital engagement with marketing and their desire to continue to grow, and clearly education of the educational of the nursing staff is crucial to your continued growth. You need to be patient, you need to be flexible, have a dedicated team and a dedicated committee that continues to review processes on a monthly basis so you can continue to improve your organization. This is a perfect example of one of the days that I was fortunate enough to have 3 rooms and 3 robots where I was able to perform close to 15, 16 cases. And there are days that I have performed up to 21 cases from 7 o'clock in the morning to 6 p.m. And that allows for incredible efficiency and turnover to address patient needs, especially at the times when patients' volume requires that we address them in a prompt manner. Needless to say that we have been very fortunate to have the Intuitive Hub, which has served a tremendous value in terms of telepresence. I provide educational opportunities not only to my own surgeons in my own institution, but also remotely. In fact, we have had remote connections to India, to Japan, and throughout the United States, whereby surgeons can request certain specific cases. They can watch all facets of the operation. The operations are recorded and they can be self-analyzed and they can be used for educational purposes, and you can self-monitor in terms of critical review of any cases that you perform that happen to require a second review based on any particular cases that were interesting, unusual, or there were unforeseen complications. And this Intuitive Hub element has allowed the integration of the education and self-improvement and promotion of our program to other organizations. Clearly, a robotic program brings a value not only to the patient, but also to the hospital and the surgeon. I want to say thank you to all of you for being here with me this morning. I apologize for not being able to take any questions directly. My email is available and I am available to answer any specific questions that would be of interest pertaining to the growth of your robotic program and its continued success. Thank you, and you all have a pleasant, wonderful meeting, and I want to thank the committee and Dr. Sani for this opportunity and privilege to share with you briefly our experience here at Silver Cross Hospital in suburbs of Chicago, United States. Thank you.